Well, North Idaho has its first confirmed case of the measles in more than 3 decades. The Panhandle Health District announcing today that an unvaccinated child in Kootenai County tested positive. KREM 2 Shannon Mowdy breaks down what you need to know right now. Shannon?
Panhandle Health says this is the first measles case in an Idaho resident since 2023. Now PhD is working to contact people who may have been exposed. As the nation's measles rate surged to numbers not seen since the early 90s, North Idaho is now investigating a case of its own, something that hasn't happened here since 1991. Panhandle Health will now conduct contact tracing, starting by interviewing the patient's family, says Dr. Christine Hahn with the state's Department of Health.
Then next, it's like, okay, where else has that person gone out and been to a sporting event? Have they been to a local church? Are they going to school?
Kootenai County's positive case comes about a week after PhD reports measles was detected in Coeur d'Alene's wastewater. Dr. Hahn says this indicates the existence of other measles infections.
You know, they may be no longer infectious. They may be fully recovered. But we think that, you know, one person doesn't get it from nowhere. There probably is or was someone else with measles.
PhD says the MMR vaccine is highly effective. Adding 2 childhood doses are all most people need to be protected for a lifetime.
We want to advise people to take this seriously, to look at their immunization records, look at their child's records.
Dr. Hahn says Idaho ranks in the national average for babies getting their first MMR dose. But the GEM state stands out with the highest rate of immunization exemptions in kindergarten-age children.
So we're at 78% of kids have documented immunity, that have the documented 2 doses. That's really low. That's lower than any other state.
That other 22%, children who are exempted, may be partially protected with 1 dose or could be wholly unvaccinated.
The difficult part is we don't know.
Measles symptoms can appear a week or 2 after contact and include high fever, cough, runny nose, red eyes, and the distinctive rash. Shannon Mowdy, KREM 2 News.